watch us live. Then, if you don't want to go through social media platforms, or you don't have a TV set beside you or in front of you, you can actually download Galaxy Television app from Google Play Store Apple Play Store. Today is quite interesting because we're discussing something a bit quite different from our very usual, and we're talking about pregnancy in women. There are a lot of stages. I've heard some very weird things about people when they're pregnant, and in fact, I've seen a lot of experiences of women when they are pregnant, especially when it comes to cravings. It's wild. But of course, I have two registered nurse and midwife that are actually here joining us via Zoom to educate us on this period. And of course, men, you need to sit in front of your screen TV, pick up your phone and start listening, because see, as much as women are pregnant, you're as good as pregnant if you are the husband, because you have to support. It's a whole lot. But let's go on a short break, and when I come back, I'll introduce my two Zoom guests, and of course, we'll get talking about pregnancy in women. Stay with us. Let's go for the short break.
For me?
Yes, for you.
Okay, I wouldn't want to go by the way of specific diagnosis. I would like to go by the way of symptoms, because I know that people come up with symptoms and they mention symptoms to their health providers, and then the health provider or the healthcare provider will be able to treat and make diagnosis based on those symptoms. So I'm going to start with the commonest symptoms that most pregnant women feel when you're pregnant, especially in the first trimester. And there are normal symptoms, and there are the ones that point us towards a diagnosis, like a health problem. And you have asked specifically about health problems, right? Now, the first symptom of pregnancy is missed period. That's obviously not a problem. Once you miss your period and you are in a marriage, it will not pose a problem. But when you miss your period and you are outside of marriage, it automatically leads to thinking about abortion, which is one of the biggest health problems we have as women, young women especially, women that are not ready for pregnancy at that time. And this has led to a lot of problems in our society, especially among teenagers, right? And this is a problem that it looks as if it cannot be held down. It looks like it's getting more and more in the society. Now, we have other conditions, right, of people that are actually ready to be pregnant, which is miscarriage. You know, when you miss your period, you're already excited, the man is excited, the wife is also excited that, oh, you're pregnant. And then they begin to experience threatened abortion. You know, threatened abortion is one of the commonest problems of pregnant women, right? Now, when your pregnancy is threatened, it's not just when you have pain, because some people will have slight pain when they take in or within the first 3 months of being pregnant, right? Now, when that pain is accompanied by spotting or loss of blood, then you now begin to find a reason to worry and begin to see, oh, I need to do something about this. And this is one of the major reasons why we encourage people to register on time. You know, we have in the African setting, we have a lot of people registering, booking their pregnancy, right? Or presenting the first time. That's what I mean by booking, right? You're presenting that pregnancy the first time at the hospital at 8 months, at 8.5 months, at 7 months. It's crazy, you know. When you talk to some women, they'll say, nothing to me now, I beg you, don't disturb my life. Oh, my mama born 7 children, she no go hospital. So when you hear things like that, even you, the health professional, you will not even know what to say to those kind of people again. You'll be like, are you trying to say that good health runs in your gene, or good perfect health runs in your gene? Now, for people that have threatened abortion, even before the required time to register, because you're required to register or book your pregnancy at 16 weeks at least. 16 weeks. Now, 16 weeks is about 4 months, right? But I usually encourage people that once you know you're pregnant, it's not going to bite. Just register the pregnancy. Let your blood pressure be taken. The earliest your scan is taken, the first scan that is taken, if your scan is done at 2 months, the accuracy of your EDD, that's your expected date of delivery, is far more accurate, right? The accuracy is more dependable than a scan that is done at 7 months or 8 months. You know that the EDD that is written there, you cannot really rely on it so much. That is why they always tell people pick 2 weeks before or 2 weeks after. So now, most times it's this threatened abortion that will make people run to the hospital and say, e be like say I wan lose this pregnancy o, abeg, we cannot afford to lose this. Or some cases, if people don't have issues, they will not go to the hospital with their pregnancies. So it's nowadays, okay, especially in teaching hospitals, in enlightened societies, we are having some people register their pregnancies when the tummy is totally flat, and you're like, madam, wetin you dey do here? And people are like, I'm pregnant, and she's like, okay. Okay, you know, we have a lot of slim people that even at 5 months, their tummies are still more or less flat. You wouldn't know anything is going on inside them. So the way to handle that, like you said, is to actually register on time. You know, when your baseline blood pressure is taken, your baseline heart rate is taken, your baseline respiratory rate is taken, your baseline temperature is, you know, everybody knows what you were as before you got pregnant or within the first 2 months or first 3 months of being pregnant. Then when you come again after 2 months and they take your vitals again and they can compare that, oh, there's a little deviation from what we saw before. And then you come the third time and they say, oh, there's another deviation from what we saw. They will be able to care for you faster, and they'll be able to care for you more effectively than if you came suddenly out of the blues with head on pee. You know, when we say head on pee, you came with the baby's head in your perineum. We will just take the delivery and tell you to go home. You know, so it's threatened abortion that makes people get to the hospital. One of the commonest conditions. I have a lot to say about this because we are in a society where a lot of things come to interplay. Some people will tell you that if we go back to the times of the Bible, the Israelites were busy walking away themselves and nobody was looking after them. They were pregnant and they put to bed. You know, there's this slang we have in midwifery and practice, like the midwives of old, give us good homes, like the women put to bed before the midwives came. Those midwives were obviously in the category of traditional birth attendants, not like they were trained officially in a healthcare facility. So I think the idea was handed over from genealogy, from generation to generation, from mothers, from old women to another set of old women, teaching them that this is how you are going to take these deliveries. And God has been faithful. I think God is far more faithful to Africans. Now, we should not take God for granted. What I usually tell people, as founder of Pregnancy Support Foundation, we go into the less privileged societies, like the locations where we find these people that actually go to see traditional birth attendants. I will never castigate anybody for trying to help, right? So because you ask me, are they helping? Definitely they are helping. But in the same vein, some people don't know their limits. Some people don't know when they have gone beyond what they are supposed to do. They don't know the right time to tell the mother to go to the hospital. So in a situation like in a setting like Nigeria, we usually tell people that even if you have the mindset that this traditional birth attendant is helping you, please still register in a general hospital or a teaching hospital, because these people will not be able to help you when there are complications, because the first pregnancy may not be the same as your second pregnancy. It may not be the same as your third pregnancy. If everything went well with your first and second, it does not mean that the third one will not present in a totally different way. Anybody can have hemorrhage at any time, and hemorrhage is one of the commonest issues that come up with women that are put into birth, especially in the second stage of labor. Everything would have gone well in the first stage for 12 hours, and then the baby is coming out, and the baby comes out and she opens taps, you know, because something open tap. When she opens tap, there is hardly anything this woman, that traditional birth attendant, can do for you at that time. She can do her best. She she knows a little about misoprostol, she may be able to give you. She knows a little about this, maybe. But in that kind of situation, there has to be immediate and early referral. So it's the best advice I usually tell pregnant women: just please do well to deliver in a setting where they have facilities, not just in any private hospital, because a lot of people just say, oh, I will use this private hospital at my beck and call that is close to my house. But those people will still have to refer you to another setting if a problem comes up, right? I'm not saying that we should overflood the teaching hospitals, definitely, right? But I usually advise people, in case you fall into labor in the middle of the night, there should be somewhere nearby that you actually first of all report to. Even if you cannot move at 1 a.m, you're like, everywhere is dark, they don't lock our gate, they don't lock our compound, they don't do this one. Okay, go to somewhere nearby. Now, these traditional birth attendants, they are trained to some level, but they are not officially trained in healthcare settings. So there is a limit to what they can offer. And the problem with Africa and Nigeria is that these women will try to be proven, like a mother is trying to prove to the children that I can cook this jollof rice. What are they cooking there that I cannot cook? Waiting. When you now eat the jollof rice, you discover that the taste is different from the party jollof rice, and the child is telling you it is party jollof rice I want. So there will always be the difference in that that expertise. There will always be a difference, and that difference can mean the difference between life and death. And once you are dead, you are dead. Nobody can say, oh, no, let's call her back so that she will go to the right location. No, they cannot call you back at the time you have gone already. They will just say, we are sorry, we have lost the mother, but the child is alive, and the man will be left alone to to take care of his child. So that's what is giving us the high mortality rates that we have in Nigeria. Those locations, those locations in which we have so many women, there is a large population, very, very large population in the interiors. That's why we go into those places for outreach, so that we can let these people know that this is the right thing to do. Please do well to do it. Save enough money before you get pregnant, and before the next baby, please rest well and save well before you decide to get pregnant again.
Before you answer the question, I just want to put it in a very simple term. Is it true that as a woman that has a big stomach before even getting pregnant, when she gets pregnant, is it true that the stomach gets bigger? I think maybe that will just probably put the question in a very bigger place. Or someone who is slim, because person has flat tummy, when the person is pregnant, the stomach will not be too big. I'm saying this because I've heard a lot of men say that. But when you tell them, they'll be like, no, it's not true, it's a lie.
I believe you have seen men that are very slim, that can eat a big bowl of eba, and their tummy will not expand. Like, I have an uncle like that. He will eat a very mighty, as in he eats heavily, as in he eats food for like 3-4 men at once. So, and he's very slim. And when he's done eating, the tummy will remain that way. Now, the major thing we are discussing here is the flabbiness of your abdominal muscles. If you are a woman and your abdominal muscles are your abdomen, that is the muscles that are below your breast, between your breast and your vagina, the muscles that are there, if they are firm, very firm, if you get pregnant, the uterus will definitely expand, but the firmness of your abdominal muscles will determine how big it will look on your clothes, right? Now, to answer your other question about people being big, people being small. Now, for some people that are slim, immediately they get pregnant, it may be obvious depending on the kind of clothing they put on. And it depends on how firm their abdominal muscles are. So if they have a structure that is firmed up, it will be very hard for you to come up flabby. If your abdomen as a single lady is already flabby before you even got pregnant, like it's just flabby, the uterus will carry a baby and it will have space enough to move forward. So your belly will look bigger. Even if you are carrying a single thing, even if you are carrying a single child, if your abdominal muscles are firm, it holds up the uterus better than someone that has a flabby abdomen, right? So that is why people decide to work out, and then when they work out, they see that the abdomen gets firmed up. Now there are some people that are fat, that are on the big side. Let me not use the word fat. They are on the big side. Yoruba people say that the body swallowed up the baby. Now, if you are flabby already, your abdomen has space inside, like fatty collections are already between the layers of your muscles. Fat has already collected, so you already look big. You even look pregnant when you were not pregnant. Now when you eventually get pregnant, there is enough space for the uterus to even expand. That some people will say you are even pregnant at your back, like the pregnancy hid at the two sides. They will say the pregnancy was hiding at the sides of the woman. And then some women will wear bigger clothes. They are already used to wearing large kaftans. So when they wear a kaftan or they wear a hijab, you wouldn't even know they were pregnant until they put to bed. So it should not make any difference. But for someone that likes to wear jeans, she likes to wear a crop top, a very firm top, and look sportish, immediately there is a difference in the abdomen. Everybody can see that, oh, this person is pregnant. It's obvious. So that firmness of the abdominal cavity plays a very big role. If you were already flabby before you got pregnant, if anything gets in, it will move forward and it will be obvious to everyone that your belly is bigger than it used to be. I think that's just an additional factor to the three she mentioned.
Yes, that does justice. Yes.